in most of our august previous conversations on health, whether they be with Romano or provincial representatives, all of those various solutions have been posited. Papers have been drawn up by well-educated researchers and deposited on the desks of various politicians, all to molder and gather dust. Which, doesn't give me a lot of hope for the future of this conversation, which is coming up in healthcare, particularly the way the table is being set, as has been alluded to already with the notion that somehow we can't afford our current healthcare system. And I will leave that to greater minds than mine to argue the economic points. But clearly, the majority of us who work in the system don't believe that that's so. Anyway, I was asked to talk about healthcare from a nurse's perspective, and I thought I would tackle this from 2 points. One is the fact that we are desperately short of healthcare personnel in this province, and I'm going to speak specifically to nursing, but I can tell you that yesterday I attended at the Vancouver Coastal Health Authority a meeting of all of the healthcare unions with the CEO and the head of human resources to review the pending shortages of healthcare. And by the year 2015, unless we do not produce significantly more workers in every category, whether that's pharmacists, physiotherapists, registered nurses, care aides, LPNs, building trades, people who support healthcare, we will not be able to deliver services even at the current level. Programs will have to shut down. Right now, the programs we're operating are operating largely on overtime, which in and of itself is a cost to the system, and that's provoked by the shortage of staff. Now, there are some who would say that the creation of this staff shortage is in of itself a strategy to undermine our publicly funded healthcare system and set up a system of competition whereby private centres who can develop much better quality workplaces and provide, for example, much less night shift, much less on-call, that kind of stuff, will then draw staff away from the public system. And we're seeing that already. The private surgical clinics are drawing OR nurses out of our ORs, in part because our OR nurses work extensive amounts of on-call. In some of our communities, the call may be as much as more than 50% of the year they're on call, which doesn't leave much for a personal life. Whereas in the private clinics, the call is almost negligible because they close at 11 and don't do surgeries at night. Surgeons are able to regulate their hours of work. And as well, we're now seeing the new emergency center, which is going to be opening up under Dr. Godley's auspices, is going to operate only till 11 o'clock at night, and he intends to staff with 50 nurses. And I can tell you that within the Vancouver Coastal Health Authority, well over 5% of the emergency nursing positions, whether it's on the North Shore, up the Sunshine Coast, in Richmond, or in Vancouver, are vacant right now. And so if you pull 50 more nurses out of that pot, our emergency rooms, which are already very stressed, are going to be even more stressed because they just will not have the nursing staff available to do the work. Now, why are we so short of nurses? And I would say to you that more than funding and more than privatization, the human resource shortage is going to be the silent killer of Medicare. Because at the end of the day, if the people are not there to be employed in the public system, people will turn to the private system, and if the private system can buy them from someplace else, they will. We have the absence, first of all, of a national and provincial health human resource strategy. I don't know how many national meetings I've been to in my various roles, how many studies I've participated, including the National Nursing Sector Study, including provincial task forces. We have been promised a national and provincial strategy for 2 decades. We have august committees of politicians meeting regularly under the auspices of the National Health Human Resources Action Committee. We hear that there is a human resource strategy plan for the province on the desk of the minister, which has been there for 2 years. We have not seen it. There is no plan, nationally or provincially, to deal with the health human resource shortage which exists not only across Canada but internationally, particularly of registered nurses. And I think that's a huge issue, the fact that we have basically, through the failure to produce a plan, whether intentional or not, produced the shortage that we have today. Just some data which you may find alarming, which I thought I would give to you today, just to underline my point, is that despite all of the claims of increased education of registered nurses and increased production, which you hear regularly from our current government, BC's registered nursing workforce decreased by 475 nurses, that's 1.7%, between 2004 and 2005. Canadian nursing workforce as a whole increased by 2% for the same period. So what's going on in BC? BC has the oldest RN workforce in Canada. The average age is 46.4 years, and if you look around the hospitals, you're going to see a lot of gray hair running up and down those hallways doing jobs that are made for 20-year-olds. And it's taking a toll on their health, their physical well-being, as well as pushing them to retirement. BC has 7,282 registered nurses in the workforce who graduated 31 or more years ago. 31. And I'm one of them. And we have the lowest direct care ratio of registered nurses to 100,000 population ratio in the entire country. The Northwest Territories and the Yukon have more registered nurses per population than British Columbia, okay, just to put it in context. And the workforce pattern is also disturbing in that during the period of cutbacks, which was the 90s due to the absence of federal funding, we certainly started seeing many of our employers start to have a more casualized workforce as there is out there in the rest of the industries, which for nursing has significant implications. Currently, 19% of our members have multiple employers, which means they're not working consistently at one work site, but are cobbling together an income through 2 or 3 employers. And we have the highest percentage of a casual workforce in the country. Fully 15% of all the registered nurses in British Columbia work as a casual, which is on call, and 25% work only part-time, which means several things. One, we do not have enough full-time jobs being created, even though the work is there. And secondly, these people are not being utilized to their full capacity, which means we're not getting the type of work hours we need out of the workforce. And finally, it also provides difficulties for our new graduates in terms of integrating their practice when they come out of school. If you can't get a full-time job with a full-time mentor and a consistent workplace, it's hard to develop the types of consistency and skills that you need to have. And certainly the Canadian average around casual workforce is 8.7%. Finally, I just wanted to highlight for you the fact that we are not growing more nurses as we've been told we have. In terms of the new nurses registering with the RNABC as new graduates, the number for last year was only 838. So we're not producing thousands of nurses a year. And the total of new registrants, which is new grads and out-of-province or out-of-country registrants, was only 1,500. So again, this is a province that imports 50% of its workforce from elsewhere, and we're certainly not getting up to that. Our admission rate to the schools of nursing is slightly up, but anecdotally we're losing about 20% of the students to attrition. Once they get a feel for what the workplace is going to be like, they say, sorry, too bad, so sad, I have other options, I'm out of here. And depart early. We also are experiencing a 2-year attrition rate where people are in the workforce for 2 years and decide that they better get out now while they can. And those are all problematic for us. How do we resolve these issues? Well, we have been putting forward to our employers and to government plans around this for many years. The restructuring of the healthcare system has really hit nurses hard. And I want to give you 2 concrete examples related to patient care so that you can see how important it is that we deal with this. One is that the nurses in one of our surgical units at the Royal Columbian came to me and I said to them, if there was one thing I could ask your employer for tomorrow that would make your work life better, what would it be? And they said, more sheets. And I said, what do you mean more sheets? More bed linen. And I said, okay, that shouldn't be too hard to do. Well, no, it is. I had a meeting with all the vice presidents in the hospital and said, okay, the nurses on this unit tell me they need more sheets. Running around trying to find sheets takes up valuable time. Not one of those people could tell me what they have to do to get more sheets from the private contractor who brings the linen. We have women in labor who deliver during the night, not during the cafeteria hours or the kitchen hours of our private contractors for food service. So at about 3 o'clock in the morning, having labored for 16, 17, 18 hours, they need a snack. Surprise, surprise, because now they're going to go on to recover and breastfeed. And because the kitchen is closed and because they no longer allow food to be stocked on the wards because they think nurses eat it. Oh yeah. Remember, this is an employer who disciplines somebody for using a creamer in the cafeteria for their own private porridge. There is no food for a laboring mother who delivers at 3 in the morning, even if they're diabetic. We have to send the families out into the streets at 3 in the morning to get food. So it's this type of stuff that goes on in our healthcare system right now, which impacts on nurses' ability to deliver care. And finally, I want to speak to the question of substitution because it's very controversial. In most industries, what is happening in healthcare today would be seen as a dumbing down of the workforce. However, somehow for healthcare, having overlapping scopes of practice, quote unquote, is seen to be acceptable. And as one person put it, when we're out of surgeons, they didn't call for butchers. But right now in our healthcare system, where we need registered nurses to provide complex care in our long-term cares and in the community setting, that work is being tapped out and given to people with much less education. In some cases it works, but in a lot of cases it doesn't. And we're seeing higher entrance to our emergency departments, more complex cases of illness among our seniors who are not getting the care they need. And now we're going to start putting 14-week ambulance attendants in the community to manage our diabetics. Where are we going, folks? We're going to hell in a handbasket unless we deal with the human resource issue. Thank you.